committee has anything first, I'll just see who would like to speak on it here. 258.
This is the chiropractor one.
That's the animal chiropractor.
Right. So I thought we were going to, the reason why we had waited was because we were waiting to hear from one of the boards.
And they're here.
Okay, cool.
So if you could come up and speak.
Chiropractic thing first?
Correct.
Thank you, Chairman Likas. To be correct, I'm not with the board. I'm a lobbyist representing the New Hampshire State
And
Chiropractic
first
Society.
of all, if I could get
Oh,
your
I'm sorry,
name.
Simon Thompson with no P, Thomson. I'm with the New Hampshire State Chiropractic Society. I think what we were, to your point, Representative Gota, what you guys were holding off on is on February 15th, the Board of Veterinary Medicine met. I did not attend that, but OPLC staff person Elizabeth Eaton did email me their position and suggested language. I don't know. Did you get that, Mr. Chairman?
I don't believe so.
Okay. I have one copy and I'm happy to give it to you, but I'll read what they said. And again, I don't represent them. I'm just
Yep.
stating the facts. Statement on House Bill 258, and again, this is from the Board of Veterinary Medicine. The board opposes this bill as written. The practice of using human modalities on animals needs to be addressed as a whole, and this bill is not sufficient. An animal can currently receive chiropractic care from a licensed veterinarian, so trained. Should the committee still desire to pursue this bill, we propose the committee adopt the amendment attached. The board would add referral language as follows. And here's what they recommend. Amend 258 by replacing the bill entirely with the following. New Hampshire Veterinary Practice Act, license required and exceptions. Amend RSA 332B:2 to add the following after subsection X, and this is the meat of it. A chiropractor licensed under RSA 316A, that's our scope of practice, providing chiropractic care to animals, that's what the bill's trying to do, provided the animal chiropractor prior to treating receives a referral from a veterinarian licensed under RSA 332-B. Again, that's what the Board of Veterinary Medicine would like to see. We are fine with that language as a chiropractic association because what it does is we get a referral from somebody who's licensed and trained to care for animals saying they need to have chiropractic care. And so that's, and then any chiropractor can then do that.
All right, thank you. If you could leave that up. Actually, first, does anyone have any questions for him?
So for clarification, you're saying that human chiropractors will not treat animals unless they have a referral from a veterinarian that says that.
That's what my association would like to see, yes.
Okay.
And then the only other thing I'll mention, if I may, is there was some talk about another amendment dealing with, again, provided by OPLC, same section of the law statute. This is just a different wording. An individual certified to provide animal chiropractic services by a board recognized national certification body. That's the other thing that we would be fine with. The problem with that is the veterinarians don't want to be responsible for certifying whatever national organization is. So I think that's why they preferred their language that I read to you prior.
Okay. Any other questions?
Oh,
Or,
so when you say human chiropractor,
I only have one.
I'll bring it closer, yeah.
Yeah, I have
when you say human chiropractor, I assume the animal chiropractor and human chiropractors are both human. So when you say human, when you say human chiropractor, do you mean
I think she means
one that
people
operates
who
on-
are licensed
one that
to,
works on people, or an animal chiropractor who is a human?
Glenn, come on.
No, I'm not trying to be funny. Yeah, all right.
Yeah, so, I mean,
You-
clearly, this is animal chiropractors, people who are people who are licensed to practice chiropractic on humans, and presumably they have some other training to practice on animals as well, maybe certification. But apparently the veterinary board would like a situation where if anybody's going to do chiropractic on animals, they'd want a referral from a vet. I think that's the position. So, and you know, I assume that's the correct, but if not, correct me.
Right.
Yeah.
The only thing I would just maybe correct a little bit is there is chiropractors out there that do get training for treating animals, but that's few and far between. So that's why the majority of chiropractors, and that's from both organizations, would support this because they don't mind letting chiropractors care for animals. They just want a veterinarian to refer them or to have some sort of national certification prior to being able to treat because they have no training. Most chiropractors have no training to care for animals. So if somebody just brings an animal in and this chiropractor treats it and does something wrong with no certification or no referral from a vet, that's going to be a black mark on the industry. The practice.
Representative Goley, and then Schmidt.
Thank you, Mr. Chair. So what I'm hearing is we want both the referral and some sort of certification in animal chiropractic because
That would be ideal.
two totally different.
And again, I can provide this language, both amendments where you would put that, which again is under the Veterinarian Practice Act.
Thank you.
Representative Schmidt.
Thank you, Mr. Chairman. Well, there are two questions that immediately arise. What is the referring referring vet going to charge, if anything, for this referral? And secondly, if it's, as we've been told, very difficult to get an appointment to see a vet, now we're talking about an animal that is suffering, and there is relief available in the person or on the part of a trained, certified animal chiropractor, and that person is going to be hanging out there, unable to act until they get this referral. How many days or weeks is the animal supposed to suffer while the referral process goes through, and what is the cost going to be? I don't see that that's really not either workable at all or not bound up in a lot of delays. And in the meantime, it could go, you go to the animal chiropractor, as soon as he or she's available, you get the service. And this,
So if I may
the
address,
workability is very much in doubt in my mind.
if I may address that, and just to be clear, again, I do not speak for the veterinarians, so I can't answer what it would cost to get a referral or the time frame. And to Representative Goley's point, a question, if you don't want the referral from the veterinarian, you think that's too unworkable, then language that would still be under the Veterinarian Practice Act that states an individual certified to provide animal chiropractic services by a board recognized national certification body, then we're fine. Again, you don't want somebody to just bring an animal into a chiropractor who's not had any training or certification at treating a chiropractor. That's not what we want.
Okay, just, I'll get you, Mom. I just have a quick question. That is, so if we just said any nationally certified or nationally recognized certification body for animal chiropractic, they don't want to get in the business of picking one or overseeing it or anything. But if we said anyone or we specified one, then that would be, that board and the chiropractic people would be okay with that?
Again, I can't speak for the veterinarian board, but we would be okay with that. Again, under making sure that it's under the Veterinarian Practice Act, which is RSA 332B.
Representative Goley?
Thank you, Mr. Chair. My only concern without having referral is we're now having individual pet owners trying to diagnose the problem with their animal, and the chiropractic care may not be what's best for that
Absolutely.
animal at the time. And that's the concern I have with no referral or no looking at the animal before sending chiropractic care. Thank you.
I understand that, and but what I would say is, I mean, people end up in effect diagnosing the animals before they decide to take them anywhere, and I would think if the person practicing animal chiropractic was certified, they should be able to recognize that they're not able to help this animal. That's,
If I may, Mr. Chair, that's a good point. I mean, if your dog's limping and you think it's, pulled a muscle or something and you bring it in and it's actually a tumor because it's cancer, you know, the chiropractor is not going to be able to figure that out unless they have had the proper training and certification. That opens up a big amount of liability.
Okay. I saw you, but is there anyone else here who wants to speak on 258? All right. If you could come up.
I was just gonna, if you will, I'll leave this with you. The two.
Yeah, if you would.
Potential
I think I have one of them, but I'm not sure I have the other one. I might, but. Maybe
Good
not.
morning, and thank you for hearing my
Thank you.
testimony. I am here on behalf of the Board of Veterinary Medicine. My name is Elizabeth Eaton. I am board counsel, and I work for OPLC. So we had a meeting on Wednesday during which the veterinarian board discussed this at length. So I can speak a little bit. I did share with Simon, and so I think he spoke a little bit on what the veterinarian board provided for written testimony, but I can answer some questions based on their discussion as well.
Okay, any questions? Reverend Schmidt? Or,
Well, were you here for my questions?
I was here for some of your questions towards the end. You're concerned with the referral aspect, correct?
Well, I'm troubled by the potential and likely delay that would be involved. We heard when the bill was first heard that it's very difficult to get an appointment with a veterinarian. That's what we heard. Okay. So secondly, even if you can get one, it's likely going to be a delay involved. And this is going to be the veterinarian presumably is going to examine the animal and then make the referral if this is something which is something which would require or benefit from this animal chiropractor, right? But the delay aspect for an animal that's suffering it troubles me as much as for a human being that's suffering, that's sitting in the waiting room or can't get the appointment.
Certainly.
Suffering is not a good idea. We want to alleviate that, eliminate that. We can. So the delay aspect is troubling. And the question is, what is the cost going to be for the veterinarian to observe something? And it could well be now that you have somebody who knows what the situation is because it has occurred in the past. They know that they need the animal chiropractor, right? So the referral is probably not really necessary, at least hypothetically, and so forth. So the workability aspect of the proposal of getting from here to Manchester by way of Los Angeles is of serious concern. And I think there are several of us on the committee. I'm not on the subcommittee, but we're allowed to participate nevertheless as a member of the committee. That really want to see this animal chiropractic be available expeditiously and without additional unreasonable cost. So, and I would like to hear from my colleagues.
I
And from you,
completely-
obviously, as well.
First, I completely agree with you. I have the same concerns. And at least offhand, maybe somebody has another data. I see two solutions. I'm not sure who they would make happy or unhappy, but one is to put something in the Veterinary Act saying basically that the veterinary board does not regulate in any way people in the practice of animal chiropractic, period. And then it's going to be a matter of, if people want to check if someone who's practicing animal chiropractic is nationally certified, they can do that, or have a referral for someone else who's had good experience with their animal. And if they're not happy, they can not go back. And if they're really not happy and think their animal got harmed, they can sue them. Similarly, if you get your car repaired in a car shop and you think they did a terrible job, it's really no difference. And I think the risk on the animal side, if anything, is less because not going to cause a car accident. It's going to kill people. So that's one option I see. The other option would be to require some form of the nationally recognized certification. And I do not want to get into a whole occupational licensing for animal chiropractors. I just don't want to go there, see what other people think. So either we could just say, you know, and I'm asking you because you're the only person I think here from OPLC, you might have some input. Either say any nationally recognized, you know, the outfit that certifies people who do animal chiropractic, and maybe some language to leave it up to OPLC, you know, the administrative side, not the board, because the vet board doesn't want to do this, to name ones. I know there are some, okay? Or name them in statute, but that's generally a bad idea because then the names change and more come up and all that. So what's your take on that?
Yeah, I agree with you on not putting into the statute whether there's any kind of certifications. But to back up to your first,
Yeah.
sure, I apologize. To back up to your first proposal, that would be the vet board's ideal situation to just have nothing to do with animal chiropractic in their practice act whatsoever. However, just to back up even further, currently in the practice act for the Board of Veterinary Medicine, there's a statute that deals with animal physical therapy already. So using human modalities on animals is becoming more and more common. First, physical therapy appears in the Practice Act, and now animal chiropractic is proposed to appear in the Practice Act. The Board of Veterinary Medicine made it clear that these modalities are already being used by licensed veterinarians. A referral may not be necessary if the veterinarian themselves already does animal chiropractic care or animal physical therapy. The board would like to address these human modalities as a whole rather than piecemeal physical therapy here, chiropractic care here. And perhaps there could be a more general statutory amendment that would allow rulemaking to address these human modalities used with animals. The board is concerned about just exempting animal chiropractic care from the definition of veterinary medicine without some sort of referral. And in the physical therapy statute, the animal has to have a referral to get animal physical therapy. And there's a whole process by which that referral is made. It can be called in on the phone very quickly and then followed up with a written referral. So I do understand the time constraint, and watching an animal suffer or anyone suffer is not anything that the veterinarian board wants. They do just want a high standard of care for these animals wherever they're being seen.
All right. Representative Goley. Oh, sorry. I don't know who went. Oh, Representative Hebert.
Thank you, Mr. Chair. In today's current law with OPLC, in who you license doctors, yes?
Correct.
You license chiropractors.
Yes.
And today, if I want to go to a chiropractor as a human being, I do not need a referral. Is that correct?
I can't speak to each individual chiropractor, and some insurance companies do require referrals from physicians, so it depends.
I can answer that question for you if you don't mind.
Certainly.
So I am a patient for for a chiropractor in Salem, and I can't remember the name of it right now. It's a chain, but I can go in there without a doctor's referral and I can be treated. I don't see where there's any alignment if humans are in the hierarchy of humans and animals, right? I don't see a problem with not having a referral for an animal, as these chiropractors are all certified. When you go into a chiropractor, they will not treat you if they think you have a potential carotid artery, right? They want to send you for a ultrasound or whatever they may. So I am just trying to say that we should align the law with exactly where we are in New Hampshire now without a referral. Thank you.
I don't disagree with you, except that the chiropractors are licensed and under the jurisdiction of the Board of Chiropractic Care, and animals fall under the Board of Veterinary Medicine for most situations. There are some that are exempt, specifically horse massage, equine, other equine modalities. There's a very few things that are exempt from the practice of veterinary medicine, but the rest is under their jurisdiction. And so if any an animal suffers at the hand of a veterinarian, their owner or someone else can file a complaint with the Board of Veterinary Medicine, and they may follow up with that licensing board for accountability. The chiropractors additionally are accountable to the Board of Chiropractic Medicine. An animal chiropractor would be, under this statute as introduced, would fall under neither. Or if there were an exemption, it would fall under licensed chiropractors. So it's really unclear who would be holding these animal chiropractors accountable.
Representative Goley?
Thank you, Mr. Chair. And I just want to make sure I heard correctly. So for physical therapy and modalities, they need referrals.
Correct.
And chiropractic care would be similar to physical therapy and working on modalities and that nature, or similar.
I mean, chiropractic care and physical therapies are similar.
Thank you.
Got Representative Schmidt, unless there's anything
Thank you,
else.
Mr. Chairman. So the thing is that it strikes me that if we can figure out some kind of a modality whereby the veterinary field and the practice of veterinary medicine perhaps could be involved for an initial referral, and then subsequently they would never have to go back to the vet again for an additional referral. Then that would solve some of the problem, because one of the things that we've heard is that in the past, and not recent past as I understand it, that some of these animal chiropractors were getting cease and desist letters from vets or veterinarian
I think the board.
boards, whatever, and the animal chiropractors were getting intimidated because they were getting threatened by the law, and so that's not a good situation. But what I've heard is it's not happening currently. There haven't been any of these cease and desist orders recently. So is this really a problem that needs to be fixed? And that should lurk in the back of our minds as a fact that we want to consider, I think.
Well, what we did hear was that there are people doing animal chiropractic who are concerned about their status. They aren't expanding their business. They're not advertising because there is a history of that, and they're concerned. So let me ask you again, if we decided to not have animal chiropractic under the vet board and not do licensing for it, but require that if somebody's going to practice it, they have some nationally recognized certification. Is there a place where that could fit in the OPLC statute, and would OPLC, be okay just, picking ones that seem to be functional or competent?
I can't speak to OPLC as an agency in general. I'm only here on behalf of the Board of Veterinary Medicine and not OPLC as an agency.
Yep.
I don't see putting it anywhere besides either the Veterinary Practice Act or the Chiropractor Practice Act. I don't see it having a place in the OPLC statute in general at this point, but I can't speak for the agency.
Okay, thank you. Any other discussion? Yep, Representative Grota?
So it looks like we are a situation where we have two boards that really don't want to take on the responsibility as requested in the legislature. And this sort of puts us in a quandary. So I do feel that your question about certification is a legitimate one. And my recommendation is that we wait for OPLC to respond to that, because this is not an early, we've got time.
Actually, that makes a lot of sense.
Yeah.
I could see, I know Representative Schmidt's having trouble hearing. So what I'll do if people are okay with it is I will contact Lindsay Courtney, raise the issue, and see if, that's something that they could do to pick a board or, certification outfit, one or more of them, and then get her suggestion, if they will do that, on where to put the language and what the language would be. Representative Goley?
Thank you, Mr. Chair. And I'd also like to see copies of the suggested language that we had before from Simon.
If you have those in electronic form, you could just send it to the whole committee, actually, it'd probably work. All right. Yes? Why don't you come on up to the mic? I guess Diane wants to speak as well. That's fine.
Once
Yeah.
again, Simon Thompson with the New Hampshire State Chiropractic Society. Just want to reference what Representative Bear said, and that's not an apples to apples comparison when you say a human can go to a chiropractor without a referral from a doctor. That is correct. That is true. Chiropractors go to school to learn how to treat humans. That's the only training they get. So if you now say that a chiropractor with zero training can see animals without a referral, that is not what the industry wants, and the industry would be totally against that.
I understand that. Right. And Representative, thank you.
And then just, I'll reiterate, I think you've heard it, but I got to reiterate, we do not want the chiropractic scope of care opened up and put anything underneath
Right.
there if
I'm not
possible.
looking to do that.
Thank you.
At least I'm not. All right. Representative Kelly?
I apologize. This is a passionate subject of mine. I just wanted to address a couple of points.
Can you bring that closer? Yeah. Pull it forward and, yeah.
I have this mortifying fear of microphones. So yes, indeed, human chiropractors are considered primary care doctors, and therefore you don't need a referral. But one of the things that just strikes me as so absurd, while there are so many, is that one can take one's 5-year-old child to a chiropractor. You can take a 2-year-old child to a chiropractor without pediatric referral, and the 2-year-old isn't communicating any better than my dog, possibly less well. My dog communicates really well.
Right. But I mean,
So that's one issue.
just to address that first, I mean, I think, other people who testified said the difference is, and actually I'm on board with you as far as needing referrals or even any kind of licensing, but the difference is that the chiropractic person who practices on humans has had training, is under OPLC and is licensed and all of that. Whereas currently the people that are doing chiropractic on animals are not. And so that, I think they're, and let me know if I'm speaking, wrong for you, but I think their view is that you don't need the referral for the human because the person they're going to is licensed and has to be trained and all of that, whereas the one for the animal may not be.
Right. And so I'm perfectly on board with the idea, not crazy about it because I prefer your method, but I am on board with the idea of requiring chiropractors who treat animals to have some sort of training or certification in animal treatment. I've seen many animal chiropractors. I mean, my dog has, and I have never dealt with one who was not either certified in animal chiropractic or was a veterinarian who also had animal chiropractic training. So I can't speak to the idea that there are people out there, homeless people who wander into a shop and rent a place and say, let me treat animals. So I'm on board with the idea of treatment, but I bristled a little bit at the idea of choosing one, because I think there are several good board certified animal chiropractic training things. So that's one. It was mentioned that
And again, on that one, if I can deal with them, individually. And again, if anybody else wants to speak, that let me know. I think the deal there is we don't want to be doing that. And what I'm looking to do, and I'll ask Executive Director Courtney if it would work, would be to leave it to OPLC to come up with a list of acceptable
a list of
certification
acceptable would be great.
organizations. I mean,
Right.
assuming there are more than one, which I guess there are.
It was mentioned that veterinarians can do some of these modalities. Well, currently, veterinarians or other chiropractors, I believe, can do I think it's 4 to 5 hour training program and call themselves chiropractors. And I've seen the difference. It's not the same. The training they get is not the same thing. The quick training is not the same thing as a qualified chiropractor. So that's that. And then another thing that just drives me nuts in the world of animals is that currently you can take a dog who's limping and ignore them until it's so bad you have to have them put to sleep or something. You don't, with a 5-year-old in kindergarten, if the child's in pain and they go to a public school, someone's going to see it and parents will be required to treat it or whatever. But I'm blown away. Tony knows I happen to be vegan and really into animals. But the point is, and I wish everyone on the planet were like me, and if I could be king, everyone would be. But since they're not, Tony's like, thank God. But the fact is, animals are not, we don't regulate animal care the same way. If I have a dog who's limping, I'm free to just choose to ignore it until
At some point, there may be animal cruelty laws. I don't know the details on enforcement on that.
very
But
true. But right now, currently, I guarantee you there are people in rural areas of New Hampshire whose dogs are limping and they can't afford a vet, so they take them out and shoot them to remove their pain. And we don't have sheriffs and animal cruelty people and whatever showing up like, oh my gosh, someone just did it. Animals, most people don't even care about them. And here we are talking about people who genuinely want to get care.
This is speculative.
it is. It is.
And,
I was
and we
about-
don't have
I was
speculative
about to-
testimony. I'm sorry.
That's fine. No. This really isn't to the bill. And actually, I think, we all agree that we'd like to see animals be taken care of and get good care. And that's what we're working on. So if you have any other
there.
comments that are specific to either the bill or what we've talked about specifically doing.
I guess just the point is that under this bill, it seems like mostly what we're dealing with is people who care enough about their animals to want to get care that, as we heard in testimony, they want to get care quickly and as inexpensively as possibly. And I agree that animal chiropractors can and probably should be certified in some way to recognize pain. But you can go to a vet without referral and have the same thing. They sometimes misdiagnose and treat
All right.
an
I
animal.
mean, we're not dealing with vets and any
That's
changes
my
there.
hope, that we're not dealing with
But
vets.
anyway, so thank you very much. And if there's nothing else, I'd like to, do you have something else or?
You've already indicated an intended course of action
Correct.
with regard to this, and I'm completely copacetic with that. So
All right, I'll do that when I hear back. I'll let people know. And if we actually come up with an amendment, then we can have another subcommittee meeting, discuss it, and vote on that. All right. If there's nothing else, I'll close the subcommittee work session on House Bill 258, and I'd like to open the one on 644. And, Representative Grote, I was trying to think about just where I was. Yeah. Okay, where am I? So, as I recall, we had a lot of testimony on either side on this one, and I don't recall any discussion of a proposed change. I mean, I will, yeah. Representative Grota?
Yes, so I just want to give the history of this bill because I think I've been on the committee every year it's been brought
Yeah.
up. So the bone of contention between the speech therapist and the music
No,
therapist.
this was the 644, which is the blow dry bar thing.
Oh, I'm so sorry. I stepped
sorry.
back. Step back.
It's okay. I mean, last time when we dealt with it, there was concern about, I think we passed it in the House and there was concern in the Senate about the gluing the eyelid thing, like the eyelashes on, and that was removed from this version of the bill. So I just, before we get going to see who wants to speak, I was wondering if there are any thoughts or questions or whatever that people had on this.
So I've been looking at this and thinking about this, and you've all heard me say that I'm very concerned about the aspect of hygiene and so forth, and there the other aspects. So the blow drying, shampooing, and so forth is very straightforward. I don't have a problem with that at all. But when they start monkeying near the eyes, then I'm concerned about contamination or sanitation. But also my information is that this threading thing does lead to some bleeding. That's what I've heard. Okay, that when you pull the eyebrow out, that through threading that there is some blood that comes out.
Right,
That's
we'll
what
see.
I've heard.
We'll see if, I don't have no expertise personally on that. I don't know if anyone else here does. I will point out that people do manage to cut themselves shaving as well.
Right,
So,
right,
and the world hasn't ended.
right. How would you know anything about shaving, Mr. Chairman?
I've observed it. And
But so the thing is that, but also the makeup aspect is also subject to, not that I use any, but I understand that you have to be very careful with regard to that you don't get contamination and transfer and infecting somebody.
I understand. Representative Grota? Or, oh, sorry, Representative Weber. Thank you.
I'm waving over here. I have a few different thoughts. Shut me down whenever you'd like to shut me down, but
I don't want to shut anyone down, as I demonstrated.
so my problem with this bill is just one fact. And the fact is that the language says that we will include renting a chair. I believe, coming from the business background, that there is a big difference between me owning my business certified by AS 9100 and having employees that I control, monitor, discipline. And there's a difference between me having a subcontractor in my plant. A subcontractor is not as controlled. A subcontractor does not have to hold the MSDS sheets that a salon owner, licensed cosmetologist has to control. They have to have MSDS sheets available. If I rent a chair in a salon, I am bringing with me my bag of hair dryer, product,
Yeah. Right, I get it.
all the gear I need, everything. So those MSDS sheets that have to be held by the licensed cosmetologist could present an issue. Licensed cosmetologists in school every single day are drilled on the cleanliness, sanitation. And so I had an opportunity to talk about the sanitation to understand that. And so I'm going to go back to the control of the employee versus the subcontractor. So lice, herpes, warts, folliculitis, and fungal infection can all happen from lack of sanitation. So back to control. I would rather see that rental chair come out of the bill and give the power to the licensed cosmetologist to oversee his or her full salon than to risk the required the requirements by OPLC. I'm going to get it right sometime.
So let me at least give.
And
oh, sorry. I apologize.
one more point. And I think the better question is that OPLC just changed their licensing on salons from 4 years. They would relicense them every 4 years to every 2 years now. So if we're talking about relinquishing licensing, I believe that we really need to start with OPLC and ask them, why are you shrinking down the licensing down to every 2 years now? Thank you.
Okay, so actually, on the last point, I mean, that's not part of this bill, and that's something you can certainly contact Executive Courtney and ask her what led to that. I'd like to know the answer. Hang on. Just to give my view of what's going on here, and then people can correct me or whatever. I see that there's at least 3 different situations here. And by the way, the rental chair thing was added not by the sponsor originally, but it was a request of OPLC, and so she added it to the bill. So as far as the rental thing goes, either that spot is being rented to a licensed barber, cosmetologist, esthetician, who can practice anything under their scope of practice. And in that case, not only is the practitioner licensed by OPLC and subject to any checking, disciplinary action or whatever, but also the salon, the person running the salon is a facility license, and they also have the responsibility to oversee what's going on in their salon. Okay, so, that person who's running the chair could go and, open it up somewhere else. I mean, if local zoning allowed it, they could do it in their home and they have the right equipment, with no oversight from anybody. So if anything, doing it in a licensed salon provides more oversight than that person is already allowed to do now. So if anything, it increases the level of oversight that's possible than today. So that's that one. If this bill were to pass, then, in the salon owner could rent the chair out to somebody who's not licensed, as long as they confine themselves to the procedures that are permitted, that if this bill went through, to be not licensed. So, the styling, the cosmetics, blow drying, and all that. And then the other one would be that person could practice separately, not in a salon, anywhere where it'd be legal for them to do it. But I don't see how being able to rent it creates any more risk than exists today, because the person renting that spot could operate somewhere else, not even in a salon at all. I don't know if that makes sense, but. Okay. Anybody else on this? On anything, actually? Representative Schmidt?
Okay. So one of the things is, my understanding is that the industry and the entrepreneurial types that we heard, we had a whole slew of them, Institute for Justice and, all this kind of stuff, all pushing the idea of the salons where they're just going to be doing shampooing and cosmetology types of operations. They're going to be doing shampooing and styling and so forth. And if we permit it, makeup and threading. And I don't think that's what they want to do. They want to be able to open up these non-licensed salons for just the simple stuff, not doing cosmetology, although I suppose they could have a cosmetologist working for them, because that person has their individual license already. I don't know whether they have to work in an individual salon. You've already addressed that.
I don't know the details on that.
Oh, yeah.
Before we go further, I want to ask one question. Is anyone else here to speak on 644?
No.
Okay, thank you. Yep. Representative Hebert.
Thank you. So if that were true, the MSDS sheets that the licensed salon has to have filed for review by OPLC how would that work if you just open a non-licensed place? Would OPLC take away the MSDS requirement by salons? What else would
I-
they take away from salons?
I can't answer that. No, I don't, there's no one here that I know of can speak on this, but, my take is that if they're licensing the facility, the person running it is responsible for what happens in that facility.
Follow up?
Yes.
And so furthering or moreover, then it becomes a fairness issue, I believe, if they need to run in alignment. So whatever we push through that's not licensed, then for the salon, we need to undo parts of their oversight.
I don't get that. There is licensing required to do, assuming this bill passes, there's licensing to do some of these procedures still, and not licensing not required for others. The salon owner's responsible for what goes in there. They can choose to rent to a person who's not licensed or not. Presumably they're responsible to make sure that person, follows reasonable practice and doesn't do anything that would require licensing. But as to the details of the act licensing salons, I am not an expert, so I can't answer that.
Follow up?
Sure.
Follow up. So my question then is, if we push this bill through, then anybody can go and open anywhere. We're not talking that they would rent a chair. They could just rent a place, right?
Right. I believe the chair rental thing is basically separate from the other issues in the bill, so yes.
And so that just goes back to my MSDS and
Well,
all of the other requirements.
I think the basic idea behind the bill is that, I know there's some concerns, but that the activities that are being permitted without a license are low enough risk, and they're things that people do in their own homes regularly, that worrying about that is something we would, if we pass the bill, we're choosing not to do. My view is to require a license for someone to work. The only justification is a significant risk to health and safety, and at least in my view, and other people have different views, the threshold for that is fairly high. And I don't see myself the risk of the operations they would allow to be unlicensed to be high enough to justify licensing.
And so I think my final point, last point, is just that OPLC made these salons put in eye wash units now as well. They have to have eye wash units in case they put something near somebody's eye.
Yeah.
So now they have to be, so once you put an eye wash unit in, it has to be reviewed every, I forget how many months. We have eye wash units in our own facility. They have to be, we have to have people come in and check them, and it's another
Well,
whole.
this doesn't
requirement.
change any of that. This is speculation. I'm not an expert, but I believe the concern with the eye wash stations is that people who are licensed and doing other operations are handling some chemicals that really could be very bad if they got in somebody's eyes. You got dyes and bleaching. I don't know what else they have. So I think that's more aimed at them, and this is not touching any of that whatsoever. It has nothing to do with it. So anybody else want to speak on this? Representative Goley?
Thank you, Mr. Chair. I will say when I look at this, it includes airbrushing, which is the spraying of chemicals to the face that could, at some point or another, enter the eye. And we don't know what all those chemicals are that they're applying to the face. And that's my concern. The other concern I have is with what we've talked about is sanitation and with the threading portion of sanitation. When you read the definition of threading, method of removing hair from the eyebrows, upper lip, or other parts of the body using a cotton thread to pull hair from follicles. Threading also includes the use of over-the-counter powders, gels, and scissors and tweezers. And there's nothing saying about the sanitation of those instruments that are being used as they're pulling the follicles. And when you pull a follicle, you're opening the pores. some sort of contamination to enter the body. And my concern is there'll be no requirement for any sanitation on the instruments used.
Okay. Anyone else want to speak on this? Representative Schmidt.
One of the things that we haven't discussed is, it was referenced in the hearing, but this threading apparently is something that most people learn. It's kind of a cultural thing in some, I don't even know whether it's like Arabic, the Arabic world or Haitian or whatever, but the thing is, it's most of the people that do this, I think, learn it from their families. Okay? And so it seems like it's something that it may be not very widespread in terms of how many people are out there that could do this. But as I said, I'm okay with a salon where they're going to do shampooing and styling and so forth and so on, where the lady comes in and she's going to go out that night to a dance or an event or whatever, and she wants to have her hair nicely styled and shampooed. I get that, and apparently that's a big deal, and that's spreading all over the universe, just not here yet. But it's the threading and the makeup. I'm much more concerned, and Representative Goley raises the issue about plucking and so forth, and using instruments, because you're not going to do it with your fingertips.
Okay. Unless somebody's got something new, I think we're kind of going in circles here a little bit. Representative Hebert. They're not here for, they're here for the music therapy, I believe. I know, that's why I'm trying to,
I'll close
it
out
to
my
a close.
comments. I'll close out my comments. So thank you, Mr. Chairman. So I am absolutely for this bill, and I think it was best said by one of my colleagues that we just need some guardrails on this, that we put the power in. I'm pro-business, and put the power with the cosmetologists and give them the power to have and hire people that are unlicensed to help prep, answer the phone, and help prep the next client for the coloring and et cetera, et cetera. Thank you.
all right. I'm going to make a motion of ought to pass on House Bill 644. Do I have a second? You say it. Okay. So any further discussion that we haven't dealt with already? Representative Goley.
Thank you, Mr. Chair. I'll just state that I will be voting against this for those reasons that I stated earlier.
Okay, anyone else? Okay, I'd like to take the vote, and I don't know what order. Representative Goley is a no. Representative Wilhelm. Representative Bailey. Representative Hebert.
No.
And I vote yes. So it looks like 3-2. All right. Sorry, 2-3. So that fails. Would anybody want to make another motion?
I'll move an expedient to legislate.
Okay. Anybody want, okay. Give me a moment here. I would never make it as a clerk. No, it's fine. There, people can sit in on it, but they can't vote.
We can't vote. That's
Right.
right. We're sitting in. I think that there's still some open questions. I think that you guys might want to think in terms of retaining, moving to retain the bill.
Let's do this, and then, yeah, and the full committee can do something else, so. Sure, any comments on the ITL motion?
So I like the bill where we're going, but it needs guardrails, so I won't be supporting a ITL. And to my colleague, I hope that somebody makes a motion for retaining. Thank you.
Mr. Chair, I'll withdraw my motion and move to retain.
Okay. Well, okay, you do as well. All right, fine. So that's retain. Okay, Representative Goley, motion is to retain House Bill 644. Okay, Representative Wilhelm. Yes. Representative Bailey. Representative Hebert.
Yes.
And the chair votes yes, and so it's 5-0 to retain. Okay. All right. So I'll close the work session on House Bill 644 and open the work session on House Bill 532 relative to licensure and regulation of music therapists. Representative Schmidt.
Thank you, Mr. Chairman. Well, this is a bill that's already passed the House a couple of times, but it hasn't made it through the whole process in the Senate. But the thing is that this is a viable profession that has existed for some time. It is a beneficial profession. We have a lady here who operates the salon in Dover. I've been there.
I assume it's not a salon, but music
Well,
therapy,
Why-
or unless they're called salons.
It's an entity.
And it's practice.
Practice. Okay, well, I apologize for the inappropriate word. She operates a business. I've been there, and so forth. And she has one of her colleagues here, and so I would like to see us get this going, because the problem is not that it's not out there. The problem is that most insurance companies will not pay for the service unless the practitioners have a license. That's the issue.
I understand. And actually, I recognize that music therapy can be very valuable. I had a wife of a good friend, former rep actually, and who was also a good friend, who had cancer, did hospice at home, and she had people, I mean, they weren't licensed music therapists, but people who came in the porch and played music for her from a music group she used to be in. So, and it helped her. And I'm not challenging anything about the value of music therapy. What I will say, I mean, before we go on, and I will have them come up and speak, but my objection is that given that licensing a profession limits people that can get into it, it's having the government say you can't do this unless you follow our rules. I do not see creating a license for the purpose of allowing, permitting insurance reimbursement I see that as a misuse of the whole idea of occupational licensing. Maybe something else needs to be done somewhere else, dealing with insurance companies or something else. But I mean, that's my position on that. But anyway, if you can come up and speak.
Good morning.
Can you give me your name?
Yes, so my name is Marissa Scott. I'm the chair of the New Hampshire Music Therapy Task Force for state recognition, and I do also own a business, a music therapy practice. I have 10 employees. I believe 8 of us are music therapy board certified, and we serve probably about 3,500 people across the state of New Hampshire. So I want to take time, most of the time, to really answer questions that you have, but I just want to say I hear what you're saying, that the insurance shouldn't be the only reason why someone passes a licensure. But the other really big piece of this is protecting the public from people using the term music therapy, and and there is a potential for harm. So music has there's loads and loads of research on this. Music has actual physical effects on our body. So music can lower or increase your heart rate. Music can lower your respiration rate. Music can cause your neurological stimulation that certain people with certain abilities or disabilities, I should say, are not able to process, and can be put them in a state of medical emergency. Anyone can use music in a therapeutic way, but board certified music therapists are trained to respond to first of all, we're trained not to use music in a way that's going to be harmful, to recognize when we're working with someone who is at risk for, using music at a certain decibel, or to recognize when we're working with someone who has experienced trauma that certain like lyrics in music could be triggering and could put that person into a state of psychosis that, you know, we're just really trained in how to respond to all of those things. Whereas, you know, somebody who is a well-trained musician and loves people and loves caring for people could go into, you know, a nursing home and like play music kindly for a group of dementia patients, and then they could be kind of triggered into a state of like disorientation, which could have multiple physical effects on their body, and then that person is kind of like, oh, I don't know what to do with this because I just came here to make some nice music for people, and so the licensure piece really takes the state saying, okay, like there is a potential for harm here for an untrained person. And so these people are trained, they're educated, they've gone through rigorous clinical experience, and they are able to call this music therapy. They are able to say, this is music therapy. Having somebody walk into a hospital and say, oh yeah, I don't know how many times I have encountered someone in the grocery store and told them I'm a music therapist, and they've said, oh, I do music therapy. I put music on my car. I'm a music therapist. And that's not what we're trained for. I don't have hundreds of thousands of dollars in like school education loans because I play music in my car. Or like I don't tell people to like lay on a couch and listen to music and you're going to be all better. That's not what we are trained for. It's more rigorous. It's more intentional than that. And so there, you know, you wouldn't go to like a dentist and I guess like ask them to like look at the bones in your fingers. And so like what we do is really specific.
Okay. Any questions? Oh.
So I want to provide some history to this committee on this bill.
Yeah.
So this has been a bill that has been before the committee, and the original issue with the bill was that speech pathologists and music therapists, the lines of demarcation were fuzzy, and the speech pathologists were concerned. And so this language that's in the bill that's been amended is agreeable to the speech pathologists and to the music therapists. So I think that this is a big step that was taken. And I think
So is the only change to eliminate some conflict?
right. Well, yeah, but that's a big deal, right? Because we want the music therapists and the speech pathologists to at least have an idea of where their fields separate and where they can work together. And that was the issue, that because oftentimes speech pathologists and music therapists work together to address issues that children might have, for example.
What I'd like to do is just proceed with the underlying issue of licensing or not licensing music therapists, and then, you know, we could consider the amendment if we choose to go down the licensing route, if that makes sense.
So what you're saying is you're going to ignore the amendment and you're just going
Well,
to try to handle the bill as it is, which is flawed.
My intent is to offer an ITL motion on the bill, and I would offer the same if it were amended, because my objection to the bill is got nothing to do with the conflict between music therapy and speech therapy. I don't know that it would make sense. I mean, and maybe I'll lose, and maybe then we'll go on to take care of the amendment, or maybe that'll be done in the full committee. So
Are we able to speak side by side?
sure, come on up.
Thank you.
Yeah. May I address your first?
Yeah, right.
May I address your first question?
Would you please introduce yourself first?
Yes. My name is Rebecca Gilday. I am a music therapist in the state of New Hampshire.
And what was your last name?
Gildea, Gildea.
Okay, thank you.
Yeah. So one of the things that you said was you're concerned that licensure would prevent music therapists from working in the state. And actually, what our issue currently is that music therapists are having a really hard time working in the state at all. It's very difficult to have a job in the state of New Hampshire because of the sources of payment for music therapy services. It has the growth rate for music therapists for jobs in music therapy has been unbelievably slow in the state in comparison to other states, especially in comparison to states who have passed music therapy licensure. Their jobs have increased significantly once licensure was passed. And it's not because music therapy is not effective. It's not because it's not efficacious and medically necessary for some folks. It's because there are barriers to seeking services, and primarily that comes around it comes around either having private pay or some kind of grant funding, which is severely limited. And if we're wanting to bolster business and bolster young people coming to our state, we want to make that job growth and job avenue as helpful as possible. And so this licensure bill is going to help that. And it's not saying that like to become a music therapist, you already have a set of regulations you have to meet. That's already set by the Certification Board of Music Therapists. It's a national accreditation agency. So anyone wanting to go into the field already has a set of standards that they have to do. But after they do all of that, when they have to look at what the job market is, they travel out. They don't come back to New Hampshire because we have 4 agencies, 4 music therapy agencies, 3 in the entire state. And there's only 48 music therapists working here, either privately or through those agencies.
Okay, thank you.
And to follow up and comment on that, we have at least 60% of our music therapists in the state living in New Hampshire and working in other states, driving and working in other states because they just can't get reimbursed for their work here.
Okay, I have a question that maybe you folks can answer. In states where it is licensed, does Medicare or Medicaid provide reimbursement for music therapy?
Yes.
Okay, thank you. Any,
Also, I mean, just there is a music therapist, and I am totally forgetting what state it is, but I have it in an email somewhere, who works in a hospital setting. They're employed by the hospital, and when their state passed licensure, the hospital gave them a $40,000 raise just because they had a license. So like that's just showing you why people are wanting to go to places that have licensure, because if you had the choice of like, oh, I can maybe make $10,000 a year or I can make $50,000 a year, I'm going to go to the place where I can make an actual living. I'm going to go, I have,
I understand.
yeah.
Thank you. Any question? Representative Goley.
Not really a question, Mr. Chair, just a comment, if I may.
Certainly.
As we heard in testimony when this came before us, a number of folks testified that this helped out. And we heard in testimony that doing the wrong type of therapy can have bad effects on individuals. And the most moving for me was when you have a Vietnam veteran up there looking for care and having to pay out of his own pocket for that care that obviously is helping him, and he told us it was helping him, and it was very helpful, is a reason why I will support this.
Okay. Anyone else? Okay. I mean, I mentioned earlier what my view is, and just want to say that it's not just me. I'm not this a mean person over here. There are quite a number of states, I don't know the number, who before a new occupational license, a new profession can be licensed by the state, before a law can go in place to create an occupational license, and before the legislature can consider it, there's a requirement, and this is kind of like, we have fiscal notes on the bills. There's a requirement that a group, which is, it's under the executive branch, but as independent as possible, looks into, well, first of all, the legislature has set up what are the justifications for having, general justifications for creating, requiring a license for a profession. And so what they're tasked with is taking a look at the new profession looking for a license and seeing if the license is justified under, under that list of requirements. And they get people to come in and give testimony and all of that and generate reports. I've skimmed through some of them. I didn't read them all. There's one of them that's almost 300 pages because it's got everybody's testimony. But just to give there are 8 states that have done this kind of a review on occupational licensing for music therapists specifically. One of the states actually did it twice. And in all but one case, their conclusion was there was not a justification for licensing occupational therapists. And those are, Colorado, they did it twice because there was a second attempt. Utah, Washington, West Virginia, Nebraska, and even our neighbor Vermont rejected licensing for music therapy. And part of that is, when the criteria that makes it justified to have a license was set up, the reimbursement issue, none of the states included the reimbursement issue. And my view is that is a completely, I recognize there's a problem. Maybe it needs to be fixed somewhere else. But in my view, it's abuse of the concept of occupational licensing to create an occupational license largely for the purpose of permitting reimbursement. And all of those states actually did look at the risk issue on occupational licensing. And actually, I'll forward a thing that has links out to all of them for anybody who wants to look at them. Some of them actually have, each individual small concern raised by music therapists to justify the license and their analysis of it. And also, at least one, maybe more, did a survey of every incident where there was any report of somebody having any kind of a harm based on occupational therapy, and they did an analysis of that. So I will send that around. Sorry I didn't do it earlier. I just got access to it in the last couple of days. So anyway, unless there's more discussion, I'll make a motion by ITL on House Bill 532. Is there any discussion on that? Yeah. Representative Goley.
Thank you, Mr. Chair. And I will once again say we heard numerous testimony on how this helps, and I find it unfortunate that a lot of those individuals, unless they can pay out of pocket, will not get the services they need, or will have to travel to another state that offers that service. And it's also,
Oh, sorry, interrupt. I neglected to get a second. Does somebody second that? Baylor. Okay, thank you. Sorry. Continue.
it's also unfortunate that we are losing a number of workers here in this state because of that reason, and they are leaving the state for that. And in doing so, leaves a hole in a very important service to a number of individuals, including our veterans.
Okay, thank you. Anyone else? Representative Wilhelm.
Thank you, Mr. Chair. I find it really troubling that in the middle of a mental health crisis in our state, we would not recognize qualified therapists who can help in a different way to increase access to resources to a whole variety of folks that need it, whether we're talking about veterans, whether we're talking about young people, whether we're talking about hospice care. I just find it really sad to think that not increasing the number of professionals, knowing that 60% of therapists who are qualified in the state of New Hampshire are leaving the state to provide therapy. That's a lack of therapeutic resources that could be in the state of New Hampshire that's leaving the state every day. And so I'll be voting against the ITL motion.
All right, thank you. And I just want to make clear that, I mean, my position is in no way an indication that I don't think music therapy can be valuable. But I've explained my reason. I don't need to do more. Any more discussion?
I too find it puzzling, and not just in this case, but we've heard dozens of these things, that we need a license to get reimbursed. It seems like at some point we should be following that up to what causes that and make it stop.
I agree. If you can turn, we're not at this point, actually. If you can turn the mic off, and thank you for testimony. Yeah, Representative Wilhelm.
Thank you, Chairman. I guess without some sort of other mechanism to, it's like we're working within the system that is. And so, just another reason why I'm going to oppose the ITL.
I understand, certainly. Anyone else? Representative Hebert.
Thank you, Mr. Chairman. My question to one of my colleagues' questions is there anything on the horizon to be able to accept insurance through the legislature's
I'll give you my answer, and if anybody else has more, and that is, I mean, in theory, we regulate insurance companies, and we could do something about that. Maybe say they had to require it not just for someone's license, but maybe if they had nationally certified, recognized certification. However, I and the legislature don't have a lot of influence on the federal government, and they're an issue as well. Representative Schmidt.
Thank you, Mr. Chairman. I think one of the reasons that you have to have a license in order to get paid by the insurance companies is so that you get people who are actually trained and qualified, because it is a profession. And they won't pay, just like if you've got a doctor who's got all the training in the world, but he had his or her license revoked for moral turpitude, financial fraud, or whatever.
Yeah, I think we got the idea, and I understand that. I mean, there are ways other than licensing to deal with it. So I don't know. Does anybody have anything else? I think we need to move on, if that's all right, because we may have other things to deal with. Okay. So Representative Goley.
No.
Representative Wilhelm.
No.
Representative Bailey. Yes. Representative Hebert.
No.
And I vote no, so that's 3-2. We've adopted the ITL, and I understand others disagree, and I understand the reasons why, and we can. What happened? Oh, I'm sorry. You voted no on the ITL. I am just confused. Sorry. My apologies. It's like, yeah, ITL, all that. Okay. All right. So the motion fails. That's fine. Does anyone want to make another motion?
Yeah. Thank you, Chairman. I'd like to introduce Amendment 0480H.
Second.
Okay. All right. So, Representative Grota, if this is the amendment you came up with, if you can kind of give a little more of an overview of just
Of
what it
course,
does.
thank you. This amendment was submitted by both ASHA, which is the speech pathologist group, and the music therapist, and it was their and they both support this amendment, and it does talk about the different delineations between the two professions and where they work together. So it's the first time actually that we've had this clarity between the two professional groups, and so I hope that the committee will adopt it because it is important. Thank you.
Thank you. So I haven't seen this before. Does it?
going to tell you where it.
Yeah,
where-
how does it differ?
Okay.
You know, I mean, not in, doesn't have to be in enormous detail, but some idea of where
Yeah,
it draws
I can
the
tell you
line.
where it takes the the current bill thing. So it takes the current bill and adds section 3, where it says collaborating with the individualized family service.
Where is this
I'm so sorry. It's line 19.
on the amendment?
That
Oh,
line.
great, thank you.
That line was added along with, on the next line, collaborating with the client's treatment team, including this is the part that was added, including the client's physician, psychologist, licensed clinical social worker, and other mental health professional during the provision of music therapy services to the client.
So my question is, if somebody, you know, maybe has either on their own, starting new, or they've had music therapy in the past, and they want to see a music therapist, and, you know, however it's going to be paid for, would this prevent them from doing that if they don't have a treatment team? It's almost
No.
like,
No, it's only if they had, this was the issue.
oh, there's an or, okay.
Yes, exactly. And this
Ah.
was one of the issues that we had come across in the previous bills, was because there was no statement as to how they would interweave in these positions where there was a treatment team. This is new language to the
I see. Yeah, I just
previous
saw it.
bills
I
as
didn't,
well.
I just caught the or, which takes
Oh,
care of my
okay,
concern.
okay, sorry,
I just didn't want that to be a requirement in all cases.
correct.
And the change to RSA 360, the change about not representing the public, is that the same basically?
Yes,
Okay.
those are the only changes really that were made.
Okay.
Let me just line.
All right. Actually, I'm fine with it, and I intend to vote for the amendment. Whatever I think of the underlying bill, I think this, is a good change in case the bill does pass. So,
Right.
any other discussion?
Well, the thing is that there was always objection, and
I-
opposition, as you know, from speech pathologists,
Yes.
because there's kind of like, you're doing this, no, we're not, yes, you are.
I understand.
Now
Yeah,
they've
that
resolved
conflict
their
of scope of
differences.
practice and all of that. I
Resolve their
understand that.
differences.
Yeah.
and
Anybody else? Okay, Representative Abear.
Thank you. I am planning on supporting this for a couple of reasons, but I want to be on record for why I'm supporting it. So number one, most people don't come in and ask to be licensed. They ask to not be licensed. What I mean is by regulated, more regulation, we want less regulation than more
I
regulation.
think the experience of the committee is that most licenses come about because the people in the profession ask to be licensed.
Okay.
actually. I mean,
Thank you
correct me
for the
if I'm wrong,
correction.
No.
but at least not all the time.
I would
but-
say lately we've had
Okay.
a good number of releasing the licensing, or look at the hair blowing thing
Sure.
and the
Okay.
let's get rid of licenses altogether.
I get that.
You know?
But I think in new licenses, at least I haven't been here as long as others, but from what I've seen for new ones, it tends to be people in the business coming in looking for it. Maybe I'm wrong, but anyway, sorry.
Thank you. So I am pro-business. I agree with that. I agree with one of my colleagues regarding mental health, if it helps. And this does not hit our taxpayers because you would be paying the licensing fees as a business. So I am for less taxes. So pro-business, less taxes, and freedom to want to do this is why I will support this. Thank you.
Okay, thank you. Anyone else? Okay, so the motion
Chair.
is, Yes.
So I just wanted to say, I think this amendment represents a real big step forward, given the agreement, between other providers and music therapists. And
I agree. And, I mean, I don't know, were you the one, who was involved in negotiating this deal with them? Okay, excellent. That's laudable, certainly. Yes.
and I
Representative
guess just to wrap up my point, what it says is there's a need for more licensed therapists. And I think given everything that we're dealing with the mental health crisis, I think this is a big step in the right direction.
All right, that's fine. If any other comments? I don't want to. All right, so we're voting on whether or not to adopt Amendment 0480H. Representative Goley,
Yes.
Representative Wilhelm,
Yes.
Representative Bailey,
Yes.
Representative Abear,
Yes.
and I vote yes. And so the amendment, we're recommending to the committee the amendment be adopted. All right, anybody else want to make a motion?
I'll move to pass with amendment.
Okay, a second. All right. Okay, any further discussion or?
I think we've said everything needs to be
I
said.
agree, but I have to give people a chance. Okay, Representative Goley,
Yes.
Representative Wilhelm.
Yes.
Representative Bailey. No. Representative Abear.
Yes.
And I vote no, so the motion passes 3-2. And I'm closing the work session on House Bill 532, and I think we're done, and thank you, everyone, for,
I appreciate the thorough discussion we've had
yep.
and clarity of opinion, and especially appreciate that music therapists who come forward, advocate. I have a subcommittee back in Stratford County.
Oh, boy. The fun never ends.
As the old saying goes, you don't stay here.
It's like, yeah, my view on motion to adjourn, all in favor say aye, all opposed stay. You know? All right. I need to fill out these sheets, so I'm gonna hang around for a while. Yeah, I mean, let me.